Welcome to this explainer. Look, today we're going to completely validate those confusing, frustrating physical symptoms that you might have been dismissing for years as just stress, lack of sleep, or, just getting older. Have you ever felt like something was just a little off with your body, but you figured, hey, if something were seriously wrong, my doctor definitely would have caught it by now? Well, that assumption is unfortunately doing a whole lot of damage. Today, we're going to decode the signals your body's been sending you, arming you with the exact knowledge you need to take into your next primary care visit. Decades of people describing their vision accurately and being told it was anxiety. The condition was real the whole time. Man, if you've been struggling in silence for years, this quote is for you. You are not crazy. You aren't making things up. Sometimes the medical field just hasn't caught up yet, or maybe your primary care doctor simply hasn't looked in the right place. Our goal today is to help bridge that gap. So, here's our roadmap for today. We're going to look at the trap of dismissed symptoms, dive into unseen neurological conditions, hidden structural wear, silent systemic deficiencies, overlooked metabolic and gut issues, and finally, exactly how to get answers. Let's jump right in.
First up, unseen neurological conditions.
Imagine literally seeing the world through an old, staticky TV screen. That is visual snow syndrome. It's a neurological condition causing constant static across your visual field, often coming with trails behind moving objects and night blindness. And get this, it was only formally recognized in medical literature in 2014. Before then, patients were routinely dismissed. People either assumed everyone saw the static, or when they did speak up, they were told it was just anxiety. It perfectly proves how incredibly easy it is to fall into the trap of accepting a misdiagnosis. Okay, another wildly misunderstood condition is ADHD. When most of us hear ADHD, we immediately picture a hyperactive kid who can't sit still in a classroom, right? But adult ADHD, it's a completely different ballgame. It shows up as chronic disorganization, emotional dysregulation, impulsivity, and this baffling ability to hyper-focus on interesting things while being completely paralyzed to start anything boring. The real tragedy here is why adults miss it. To the outside world, and honestly, even to your doctor, it just looks like a character flaw or laziness. But it's actually a completely measurable neurological difference. And that massive misunderstanding leads us to a truly staggering number, 35. That is the average age of an adult ADHD diagnosis. 35! Think about what that actually means. That's over 3 decades of struggling, constantly being told to just try harder, and basically building your entire identity around being the person who just can't get it together. The condition was there the whole time, nobody looked for it, and you spend 35 years blaming yourself. And ADHD definitely isn't the only condition that leaves people blaming themselves. Take POTS. With POTS, just the simple act of standing up causes your heart rate to absolutely skyrocket by 30 beats per minute or more within 10 minutes. The result? Dizziness, severe brain fog, intense fatigue, heart palpitations. Sometimes you even faint. You've probably described these exact symptoms to a doctor and been told to just drink more water or that you're out of shape. The average time to get a diagnosis is 5 to 7 years. But it's a real condition, and it's easily diagnosable with a simple tilt table test. Now, these unseen misreads happen every single day with 2 incredibly common conditions. First up, migraine with aura. The aura comes right before the headache. Zigzag lines, blind spots, flashing lights. Some people even get the aura with 0 headache at all. But it's not just a harmless light show. It's actually a cardiovascular risk factor that elevates stroke risk, especially for women using hormonal birth control. Most people have no idea. Second is generalized anxiety disorder, or GAD. GAD isn't just worrying a lot. It's excessive, uncontrollable worry lasting for months that causes serious physical muscle tension, fatigue, and headaches. People treat the headaches and the fatigue separately, mistaking a highly treatable medical condition for just being their lifelong personality. Moving right along to hidden structural wear and tear. Let's talk about bruxism and TMJ. Bruxism is involuntary teeth-grinding reclenching, and the vast majority of cases happen while you are dead asleep. You're completely unconscious, so you literally don't feel it. Instead, the signs pop up elsewhere: a sore jaw in the morning, worn-down enamel, or frequent headaches. And when the jaw joint itself malfunctions, that's TMJ disorder, the symptoms get even weirder. You get ear pain, ringing in your ears, neck stiffness, facial aching. Because a jaw problem points in 6 completely different directions, you might go to an ENT for your ears or a neurologist for the headaches, totally missing the actual root cause. And this creates the ultimate medical trap. Because these conditions are made significantly worse by stress-related clenching, the very people most likely to have them are also the most likely to be completely dismissed by their doctor with, "It's just anxiety." So what happens? You treat the headache with painkillers, you ignore the jaw, and while you sleep, your teeth permanently wear down. Enamel doesn't grow back, folks. By the time a dentist finally spots it, irreversible damage has already accumulated.
Next category, the silent systemic deficiencies.
Your thyroid regulates your metabolism, your energy, and your mood. When it underproduces, everything in your body just slows down. But it happens so gradually that most people don't even notice it first. You get unexplained fatigue, weight gain that refuses to budge no matter how hard you work out. You're constantly freezing, and you're dealing with major brain fog and low mood. People with an underactive thyroid often describe feeling like a dimmer version of themselves. But here's the real trap. Every single symptom has an alternative, highly believable explanation. You blame the weight on your diet, the fatigue on work stress, the low mood on life. Each symptom in isolation points somewhere else. We see this exact same stealthy decline with iron and vitamin B12 deficiencies. Iron is literally the most common nutritional deficiency in the entire world. When it drops, oxygen delivery to every single tissue and organ in your body drops with it. You feel weak, breathless, just totally drained. And B12 deficiency? That develops super slowly over months or even years, causing numbness, cognitive slowing, and if you leave it untreated, potentially permanent nerve damage. Huge numbers of people attribute this profound, life-altering exhaustion to just getting older, when the actual culprit is a simple nutritional deficiency running completely untouched under the surface. But honestly, the most terrifying systemic issue might just be hypertension or high blood pressure. They call it the silent killer for a reason. It has absolutely zero symptoms. You feel completely 100% fine, while it quietly damages your arterial walls, strains your heart, and skyrockets your stroke risk. Get this, the World Health Organization estimates a massive 46% of adults with hypertension are completely unaware they even have it. Nearly half. Everything feels perfectly normal, right up until a catastrophic medical event hits. All right, let's get into overlooked metabolic and gut issues. A perfect example of an overlooked gut issue is GERD. Most of us just hear that and think, oh, heartburn. But heartburn is only one symptom. The rest of this list is what people constantly miss. A chronic cough with zero respiratory explanation, a persistent sore throat, that annoying feeling of something stuck in your throat, disrupted sleep, and even dental erosion from stomach acid washing into your mouth at night. People treat the throat, the cough, and the teeth completely separately without ever once connecting them back to stomach acid. And long-term unmanaged acid reflux causes real structural changes to your esophagus, making this a seriously bad issue to ignore. Now, this next one leads to one of the biggest dietary misunderstandings out there. Look at this chart. Roughly 68% of the global population loses the ability to fully digest lactose after early childhood. Retaining the ability to digest dairy as an adult is actually a statistical anomaly. Yet people spend years informally avoiding dairy, noticing it makes them feel awful, without ever knowing there's a formal name or a straightforward management strategy for it. It's literally a default human trait, disguised as some mysterious chronic stomach bug. And the exact same thing goes for irritable bowel syndrome, or IBS. It affects roughly 10 to 15% of the global population, causing abdominal pain, bloating, and entirely unpredictable bowel patterns triggered by food, stress, or hormones. But the vast majority of cases go totally undiagnosed. Why? Because, let's be honest, talking about your bowel habits with your primary care doctor is a super awkward conversation to initiate. Instead of treating a highly diagnosable medical condition, people just silently organize their entire lives around bathroom access and assume, well, I guess that's just how my stomach works. Our final silent metabolic condition is prediabetes. Elevated blood sugar does quiet, relentless damage to your body with absolutely zero symptoms to prompt you to go get checked. The American Diabetes Association estimates that over 80% of people with prediabetes are totally unaware they have it. 80%. And this is tragic because at this specific stage, it is entirely reversible with lifestyle changes. The window to stop type 2 diabetes from developing is wide open, but it closes a little more the longer your blood sugar runs elevated. It gets caught late, not because it's hard to detect, but simply because nobody tested for it while there was still time. Finally, let's talk about getting answers from your doctor. So what is your action plan? Look at this table. The distance between missing these conditions and catching them is often incredibly short. Prediabetes, hypothyroidism, iron, and B12, they literally just require one basic blood test. POTS, which people suffer with for up to 7 years on average, diagnosable with a simple tilt table test. Hypertension, you can catch it with a $50 blood pressure cuff from your local pharmacy.
The barrier here isn't some lack of advanced medical technology. The barrier is simply knowing what to ask for. You have to explicitly mention these conditions to your primary care doctor and request the tests.
I really want to leave you with this final, absolutely crucial question. What symptoms have you been explaining away as just life, or just stress, or just getting older? Take a moment to seriously reflect on this. You now have the vocabulary, and that is your first, most powerful step to advocating for the treatment you deserve. Please don't let your health remain unseen. Bring these possibilities to your primary care doctor, ask for those tests, and take back your baseline of feeling normal. Thanks so much for joining me on this explainer, and remember, never stop asking questions about your health.